With that, I'm going to turn it over to Dan Grove. Dan is a wildlife veterinarian and he is a wildlife health specialist with UT Extension. And he is going to be talking to us very timely topic on New World Screwworm today. With that, I'm going to turn it over to you, Dan. Thank you for being here.
Yep, thanks. Appreciate it. Um, well, before we get started, um, thanks for having me here today. When we originally planned this, New World Screwworm had not entered the United States yet, but if you've been following the news, it is here at this point in time, and we'll get into that in a little bit. Little bit of a warning. I know it is lunchtime, and not everyone might be accustomed to some of the images that you're going to see, but there will be some what folks consider graphic images, so just be aware of that as we go along. And just because it's the nature of this disease or any disease, sometimes the pictures aren't always appetizing. So, that being said, I have a little disclaimer. I do not claim to be a parasitologist or an entomologist. Our goal here today is to provide a high-level overview of the current issues that we're facing with the New World Screwworm, some of the historical context of where we are with how we got to where we are, and then some situational awareness of what's going on with the current situation here in the United States as well as in Central America and Mexico. And then hopefully get folks some resources if you happen to be out in the field working with wildlife or domestic animals and think you have a case. There's a lot of resources available to you at this point. And the other disclaimer is a lot of the images, graphics, etc. I can't claim ownership of them. These are all taken from either publicly available resources, USDA, U.S. Fish and Wildlife Services, or otherwise noted from journal articles or things like that. So, with that, we'll get started. So, we're going to kind of give you a quick overview. Basically, what is New World Screwworm? Again, like I mentioned before, how do we get to where we're at this point in time with New World Screwworm? Where is it currently? And some of the management, treatment, and prevention and regulation options. I come at this from both a veterinary perspective as well as a regulatory perspective because I work with TWRA and provide veterinary services for the state agency, which means we also work with USDA as well as Department of Health and Department of Agriculture here in the state, Fish and Wildlife Service, USDA Vet Services and Wildlife Services. And so this particular disease crosses across all of those potentially those organizations. So just it really is truly a One Health type issue. So what is it? Whenever we're speaking about it, it's basically an infection caused by a fly. Cochleomia hominivorax. Don't correct me on my pronunciation. I never claimed to be a Latin or a Greek expert, but the infection with this particular insect is called myiasis, and that's a general term for any infection from a fly. Maya coming from the Greek, which means fly, technically. The unique thing about this particular fly, other than most of the flies that we typically think of, most flies we would normally think of here that are still here in the United States are going to mostly consume necrotic material or dead tissue. This particular fly, its larvae feed on living tissues of warm-blooded mammals and avian species. So anything that's considered warm-blooded, these things can actually infect. Currently, there is an outbreak in Central America, Mexico, and in the U.S. There's active infections in Texas. New Mexico, there was an infection early on, but that is now considered inactive. And this fly used to be native throughout the southern regions of the United States and the Southwest. We'll go into that a little bit. It does still exist in parts of South America, and it is a regular occurrence in those areas. So some of the ways that we identify it, we've got these bright orange eyes, a yellow-orange kind of face. There are other species that are here that kind of look like that, but some of the distinctions are there's a little bit of a shorter center stripe, and it has a metallic blue-green body. These are not, there are other species that are similar. That's why identification, if you have a whole fly, really requires a parasitologist or an entomologist that's trained in identifying these things. So if there are samples of adult flies or of larvae, that's ultimately what we recommend. And just some of the other things that are kind of unique to this, but sometimes it crosses over with a little bit of other species and why you need actual diagnosis from a specialist. Again, just some images of the different things. You can see in the bottom corner here the little hooks. These little hooks are what they actually use to embed in the tissue. And when you actually see them, and I'll show you some images here, which you're actually looking at is the back end of the animal. So this would be the front end of the animal, which is deep into the tissue, and that's what they anchor themselves and kind of chew along in the tissue using is those little hooks. So the life cycle is a somewhat typical life cycle outside of the eating the living flesh side of things. The entire life cycle takes about 21 days, which is important to remember for our management side of things. Basically, the adult flies breed. The gravid female lays her eggs on an open wound, and they can sense, the odors that are coming out of those wounds. It could be something as small as a tick bite that they can actually sense and actually lay their eggs in. Just the presence of the eggs themselves, once they hatch and the larvae start to develop and they start to eat through the tissue, um, that creates odors that then attract more female flies, and then it just compounds it. Once the larvae pupate, they'll drop off into the environment. Or sorry, once they get to a certain point, the L3 stage, they'll actually drop off into the environment, and then they'll pupate in the environment. It takes about 6 to 8 days for the pupation process to occur. So there is an environmental component to all this. And so whenever we're looking at treatment and management options, if you've gotten to the point where larvae are dropping off the animal, the environment is potentially contaminated at that point. It would need addressing also. This is a little bit of old data, but just kind of give you an idea of the types of injuries that have been associated with, like as the original injury that the flies then laid their eggs in. The most common in our domestic livestock is going to be the umbilicus. And that's even reports back when it used to be in the US, that was the most common in cattle, sheep and goats was umbilical infections. And so it was a really common thing back in the day. And I've talked with a few folks that remember going out and having to dip navels as soon as they had calves on the ground, just to prevent this disease from taking over. And as you kind of go down through, you can see a different variety of cuts, vampire bats. So obviously, we don't have vampire bats here in the United States, but in Central and South America, they do exist. And the wounds that they leave can create a place for these flies to lay their eggs. Just some of our common practices like ear tagging and dehorning can lead to that. And so some of the preventative measures are to use fly spray if you're doing those activities around those areas, as well as tick preventative to keep the bites from occurring, so that then there's not a wound for the flies to lay their eggs. So a lot of the images that we have that are the more modern day images are actually from an outbreak that occurred in the Florida Keys in key deer. So this is actually an example from key deer, and you can kind of see in the wound the larvae that have developed, and you can see some additional flies, and you can actually see some eggs along the edge of the wound, and you can see larvae in different stages within inside this wound. But then, ultimately you can see that the wound isn't too necrotic in the center of it, but on the edges where the larvae are starting to develop, it's getting more and more necrotic as they chew through the tissue. Larvae will be visible in the wound by day 3 after the eggs are laid. And there might be hundreds present. You may only see a few on the outside, but they may be up under the skin, burrowed in pockets. And they can be up to about 7/10 of an inch long or 17 millimeters long. There'll be some bloody discharge, foul odor. And the animal, a lot of times, they'll be depressed or off feed. That might be what people recognize first if they can't see the wound, because it might not be big at that point. You can imagine as the tissue starts to become more necrotic, there's a lot of bacterial overgrowth that's associated with it. So they do get a bacterial infection as a result of this also potentially, and can become septic. If left untreated, typically it's 7 to 14 days is what in the literature that the animal could potentially die as a result of this infection. And it's usually the secondary infections that they get from the bacteria. Um, Treatment with parasiticides can be successful if you detect it early enough. Obviously, if there's bacterial infection already, you're going to want to use some sort of antibiotic an appropriate antibiotic to help treat also, as well as supportive care as determined by the level of illness of the animal. In terms of mortality, as I mentioned, within 7 to 14 days, it's near 100% death of newborns if the environment is favorable. And that's based on historical evidence. We'll go through a series of pictures, and eventually you'll get the kind of the point if you haven't already. This is again a deer from the outbreak in Florida, and you can see the eggs on the edge of the wound here. It is a little bit of an older wound at this point in time, but you can actually see flies down inside the wound. You can see larvae inside the wound at this point in time. And there could be hundreds, like you don't see that much, but there could be hundreds of larvae in this wound at this point in time. And so that's why it's important to kind of pay close attention because this wound might be really small that you can't see from a distance. And so you have to get fairly close sometimes to see these wounds. If you have like a depressed acting animal, you want to check them really closely. Just some images from COPEG, which is the unit out of South or Central America that has been involved in the prevention of this and we'll get into that here in a little bit. But ultimately, this is what the pupa look like whenever they are in the ground, and just some more images of the larva. Get another image from a deer. Again, looks like from a distance, just a wound on the neck of the deer. But when you get closer, you can actually start to see, the flies, the larva inside that wound. Um, Typical around if the antlers are still growing, they will get antler bud abscesses normally, not normally, but a lot. Sometimes they can actually have breaks in the skin around where the antler bud is. It's a perfect place for these. And these have actually eaten all the way through the skin, and then the bacterial infection and everything else is actually eroded through the bone as a result. And this is kind of what ends up happening if left untreated. Again, just these wounds can get out of hand really quickly if left untreated. And again, in our wildlife, it can be a real issue. On the left-hand side here is an image from a goat, and so you can see where it probably was from dehorning, and then the fly infested as a result. Again, lesions around the eyes on cattle are a perfect place, especially if they've, kind of have the pink eyes. There's a lot of times there's insect bites and things like that, and can lead to a long-term infection. And just an example to show that it does occur in birds too. This is from a chicken in Central America from the current outbreak. And again, wound entry point or even around the cloaca. Sometimes if they're getting matting around their cloaca, that's a perfect place for the flies to lay their eggs. And domestic animals are susceptible also. This is a dog with a severe infection. So you can kind of see this is classic what it looks like. And again, if you look, all of the little packed in larvae that's basically the back end of the larva that you're looking at because they're anchored down into the actual tissue. Just some more graphic images, just so you get the picture. Ultimately, though, this is where we were back in I, the disease has been here. Well, it's been here before in the United States. We did a pretty good job of eradicating it when it was recognized to be a huge problem for the cattle industry and the domestic livestock industry. It was in the 30s and 40s when it was first kind of starting to be recognized as a problem. It took a while to figure out, basically how can we deal with this? And so through the process of releasing sterile male flies, one key part of this life cycle is that once the females mate, they don't mate again. So they figured out that if you release sterile male flies, you can basically create a situation where you don't have basically any eggs being produced by the female. And ultimately, over time, by releasing these sterile male flies throughout the environment where these flies existed, they were able to push the flies back down towards the Darien Gap. And that gap, we're at the Darien Gap there in South between Central and South America, that line had been held up until this current outbreak that started in roughly 2023, 2024. So this is kind of a comparison of back in 1976 in Texas. This is kind of a Texas centric graph here, but kind of gives you an idea of it's not just the loss of the animal, it's all of the additional labor, the fuel expenses, the medications, everything else that goes into dealing with an outbreak and what that total potential loss is to the individual farmer, as well as to just the economic loss uh, to the industry as a whole, and what they estimated. And again, this was created before the current situation. And so these are just estimates that it's billions and billions of dollars potentially of loss if this gets a foothold again here in the United States. And this is just for Texas, let alone any of the other states that might be involved. So there was an outbreak, and I mentioned this, and a lot of what we'll focus on for our preventative stuff too will be sort of on the wildlife focus, since that's the realm I deal with, but we will touch on domestic animal side of things too. But in 2016, 2017, there's a species of deer that's a subspecies of white-tailed deer they're called key deer. They're a lot smaller body. They're actually an endangered species, so they're managed by U.S. Fish and Wildlife Service. It was recognized that they actually had screwworm infection. More than likely, what happened, there is screwworm in Cuba, which is about 90 miles away from where this occurred in the Florida Keys. Uh, Either through wind or other mechanisms, the flies were brought back up into the United States during that time period. They were able to, once they recognized it, successfully manage the disease and eradicate it from that area because it didn't spread much further outside of the few keys that it was on. But they did lose a lot of the population. Estimates are anywhere from 10% to 15% of the population. And it took a multi-agency effort to actually make that occur again. And that was a lot of hand treatment of these animals as well as environmental treatment. And a lot of work went into that at that point in time. But it was a small number of animals that were impacted in a relatively isolated geographic area that was disconnected from large livestock areas. At this point, there are conditionally approved treatments that are available for our domestic animals, and I would encourage if you're in the veterinary realm and you are potentially going to run across this and treat it, to go to the FDA website to keep up with the current drugs that are available either for livestock or for domestic animals that the USDA or sorry that the FDA has approved for use in those animals. On the food animal side of things, obviously you want to worry about withdrawal times of any of the drugs that you're putting into those animals. And so that's one of the determinations that the FDA has used for approval of certain drugs and certain species. But um, this list that's here is as of August 13th of this year. That list is constantly changing. So if there's not one on there that you have access to, you may want to, check back on a regular basis. But there's kind of a wide spectrum of things that have been conditionally approved at this point in time. There's for large animal for actual treating the wound itself. There's F10 antiseptic wound spray has been approved for direct treatment of the wound. There are withdrawal times that are associated with that. For cattle, it's 30-day for meat and 10-day for milk if you have treated those animals. It's also been approved for use in like wildlife rehab settings, so in raptors and wild birds, as well as in captive exotic and zoo animals. It's not recommended for domestic cats or dogs at this point in time. Give you an idea, and sorry, I meant to include the website where this was pulled from. You probably recognize the image is the one that USDA has created, but there are different management recommendations to manage the different stages of this disease. Those are all available through the USDA website and through, so that's where this image is taken. But the code 314, like here under the growth in the environment, brush management, those all correspond to management plans that are available. And when you go down through and you're scrolling through, you can actually find the specific management plan for your particular state because it may differ based on the environment or the rules and regulations that are in your state. And so you can get each one of these that's specific to your state. Some of them are broad across state lines, but they do have the option of getting ones that are specific to your state. So just that's a resource that's available to folks that may be out there working with producers or may identify these things out in the general area. So in terms of environmental treatment, as I mentioned, what they're currently recommending is carcass removal, plus or minus spray the area with a pesticide that's approved in terms of spraying the ground and treating the ground. Freezing the carcass, if it's a small enough carcass that you can freeze up to 7 days, usually kills off all of the life cycles that may be present on the animal. Incineration or cremation is going to probably be the best way. Deep burial is not necessarily recommended because if it's not done properly, the larvae can still pupate out and then crawl, make their way back up and make their way out. It has to be deep burial, at least 4 feet deep, and you have to compact the soil really, really well so that the larvae cannot make their way out. Typically, though, if you're doing deep burial, they recommend that you coat the carcass with lime, and then also throughout the hole before you put the dirt back in. If the larvae have dropped onto the ground around the carcass, it's recommended to remove the top 2 inches of soil around that animal, just so that you can get any of those pupating, the pupal stage of the fly. And then again, there are certain environmental pesticides. That list is changing all the time. You can get that through links at the FDA. Kind of give you an idea. I just threw this in here. This is what's currently happening with animal exports into Canada from the affected area. And this is one of the impacts that we had initially it was no exports from the United States, and now they've gone back. Now that we figured out where it is, Canada is accepting some exports under conditional approval, and then these are kind of the requirements that are associated with that. So just one of the kind of economic impacts that this disease may potentially have if it gets a foothold in the United States again. This may be if we don't get it under control more so than it already is, and it expands, these restrictions will probably go worldwide more so than just here. So kind of how did we get here? It was first recognized when it was starting to make its way back up. It took a couple of years to get from the Darien Gap all the way up through into Mexico. So this was actually, I pulled this earlier this year, uh, or actually, I guess this map was from last year, but kind of gave you an idea. The border was shut down last year to imports until things were figured out as to what was going on. And then the inspections increased drastically along the border, both amongst livestock operators and producers as well as most wildlife populations. The sterile on the prevention side of things, as I mentioned before, the best thing we have for prevention is releasing the sterile male flies. Part of the problem is that in the United States, all of the facilities in Mexico that used to produce these back in the original eradication period, they had all been shut down. So there were no longer any of these facilities, and the only facility was down in Panama at Copeg. And so flies were having to be flown up initially from that area as they ramped up the production facilities in Mexico and the United States. At this point in time, the U.S. facility is not producing flies, but they are using the facility as a location for planes to take off from for distribution. And I don't believe the Mexican facility is up and producing flies yet. I believe at this point in time, and things are changing rapidly still. Most everything is being flown up from Copeg in Panama. Um, and this kind of gives you where those dispersal centers are. You can kind of see the little blue. That's where the Mexican dispersal center is. And there's actually one down here. It's kind of covered up on this map. at this point in time down here in the Veracruz area. But here in Texas, that's where the U.S. Dispersal Center will be. This summer, they were anticipated that they would actually have that up and running in Mexico. Again, I haven't been able to pick up on if they're actually breeding at those facilities yet or not. But here in the U.S., by November of 2027, if not earlier, they're expected to be ramped up to about 300 million flies per week capacity at the U.S. facility to help drive this disease back down. And again, this is all where it was at the start of this year. And dispersal flights for here in the U.S. and in the area where it was affected, they actually began back in January, about 100 million flies per week. It's a C-47 cargo plane that releases these things. So, um, in terms of the emergency response, this is what it was prior to finding it, in a stepwise process that the USDA had created. And for the most part, I think this process has been adhered to, and it's been fairly effective at this point in time. In terms of, and again, I'm not going into a lot of detail on these things because there's a lot of information to cover. And so I just want to make sure that we, more make people aware that these resources are out there. Um, and there's a multi-pronged approach to all of this. It's both the environmental side of it as well as the detection side within animals, both domestic and wildlife. And then in Mexico, there's actually been human cases. There's been one or two human cases here in the U.S. that were linked to travel to Central America. So there's a lot of entities involved at this point in time. And we'll get into some of the things that are actually in this list here shortly. Currently in Mexico, and be honest with you, this is probably an underestimate of cases, just given the rural nature of a lot of where these cases are occurring. Um, but there's an estimate, and this is as of August 24th, as of this week, they've reported over 39,000 cases in animal cases, and there's a total of close to 1,900 active cases. Meaning, of those 39,000, they basically resolved that the cases are no longer active. We'll go into what that means here in a second. But in terms of human cases, there's been roughly 500 human cases throughout Mexico since the start of this. So. In the U.S., we had our first report in Zavala County, Texas. It was a calf. It was actually treated, and it's now confirmed inactive in that particular animal. That was June 3rd of this year, and things really ramped up in Texas at that point in time and along all of the border. Texas, throughout the course of this, has had 16 counties impacted, with 37 individual premises throughout those 16 counties being impacted by this disease. Uh, Inactive with that, when they use that term, at least for the regulatory side of things, that means they have not seen any fly activity in 21 days, or they have not seen any new cases in 21 days. So it's a combination of those things. And again, if you remember, 21 days is the average life cycle of these from breeding to the point where the flies are adults again. So that's the average life cycle is 21 days. But effective facilities or premises aren't released until 90 days after they're determined to be inactive. It's 90 days total, because then that's three life cycles to guarantee that there might not be activity still. So some of the things that have been going on, and again, multifactorial approach. Obviously, there's been visual inspections of lots and lots of folks. There's actually a certification process that you, as a member of the public, could go and become certified through a process through the USDA, as well as veterinarians and a whole other host of folks that could go out and do inspections and just look for wounds and investigate and see if there's these larvae present in wounds. So there's a visual side of it, like when you actually get hands-on, and that's more the domestic side of it. There's trail cameras have been placed all over the place to watch for wildlife. There's fly traps out, and they've created a buffer around all these counties where they've placed fly traps. They've actually not caught many flies in the fly traps. The only flies they've been catching, it sounds like, are just the sterile males they've been releasing. And so in the buffer areas where they've been trapping, there's not much expansion. And those buffers are roughly 20 to 30 miles out from known areas. Um, And so there's a combination of that. They're using drones to inspect large feed cattle operations as well as look at wildlife. And they try, if they see carcasses, they try to inspect those carcasses. And so there's a whole host of things that they've been doing between the trail cams, the drones, the visual inspections, inspections at the border crossings and things like that. So there's a lot of work that's been going in, and it's been multi-agency. Both federal and state agencies have been working together to kind of get things under control in the area. It's kind of interesting. You see here, there's New Mexico. So there was one case in New Mexico early on, saying early on, it was just a couple of months ago, right? It was actually a dog that had a history of travel to the affected area in Texas. And that case has been determined to be inactive at this point in time because the dog was successfully treated. But it goes to show you that the disease can move in our domestic animals. So if we're taking our dogs with us, like when we go and visit an area that has it, the dog could potentially be bringing that back, and you might not know it until you get back. And so that it's just something to think about with animal movements and the way animals move across the landscape now in terms of with all the roads and automation that we have nowadays. There's a lot more places animals are moving to and from now than there was back in the 40s and 50s, if that makes any sense. So we do have the potential, if we don't catch it and it festers for a while, to actually spread very rapidly throughout the systems that we have in place here in the United States. All this information, and I downloaded this today just so we had the most up to date. Um, there's only two active cases at this point in time. One of those actually just became active or what day is today? Became active 2 days ago. And that was already an area where it was known to exist at this point, and that was in goats. And this information is available on the USDA website for anybody that's interested. They try and update it every day, but it seems like lately they've been updating it every other day. So, in terms of import protocols, this is where we are. They just recently, on August 24th, opened up some of the border crossings in Arizona. But there is a process by which animals have to go through before they're allowed to be brought in. Mexico also has TB. That's a general requirement, anyways, for interstate movement here in the United States. But when you're going from one country to another, TB testing is required, but they do actually have TB in some of their cattle herds in Mexico, so that is always a requirement. Um, Ultimately, they got to be treated, they've got to be inspected, but here's the process by which an animal has to go through. It's not quick, it's not easy, but there's a lot of physical inspection that goes on just so those animals can cross the border. And I should mention, I'll go back up here. One of the issues with movements in Mexico, it is extremely hard to shut down animal movements in Mexico because of just the nature of the road systems and everything else. And one thing that was mentioned in one of the meetings that we've had here recently, and this is something I never thought of, the cartel does a lot of movement of these animals. And so it's extremely hard to prevent them from moving animals and all the other activities that are involved, obviously, with the cartels. But there's not been the widespread movement restrictions as stringently applied in Mexico as what we do here in the United States, and that's multifactorial, but it's something to consider when you're trying to regulate and manage a disease. So, shifting over to wildlife here a little bit. What we know and what's available, and I blatantly stole these from Sonia Mongold, who I forgot to mention is a co-presenter on this, and I believe she's on this call also. She's with the Wildlife Health Program Coordinator for TWA. So these are her slides that she's put together for us. But on the wildlife side of things, this is kind of what we've done to prepare and look at things. If you go to this website, there is an annotated bibliography of myitis in wildlife. And so you can kind of go through that, and they've actually created a list of impacted species that they know of, because since There wasn't much written about wildlife impacts when it was in the U.S. previously. We're kind of looking to our any literature that might be available for it's known to have been endemic for the last century or so, which would be South America. So a lot of the information comes out of South America that we use. So just kind of going down through the list, you can kind of see some of the things that we have here in Tennessee. We've got, unfortunately, we do have wild boar, raccoons, white-tailed deer, eastern cottontail, Virginia opossum, egret. Um, a lot of our avian species potentially, like things like our wild turkeys, they're big enough that they could actually end up with wounds that the flies infect and things like that. So these are some of our concerns at this point in time. And we do have a lot of threatened or endangered species. We do have the Appalachian cottontail. So something like this disease could really adversely impact them if it got into those kind of species. And they haven't seen it here in the U.S. yet because they've done a lot of feral swine surveillance. Um, and they haven't seen it here, but it was reported in Uruguay that the 27 of 618 swine that they captured in a study actually had infestations with screwworm. There was limited more morbidity. Seems like hogs might be a more resilient host. Of course, that's one of the issues why hogs are so invasive and pervasive in our environment is that they can survive a lot of different things. So that is something to consider here in the United States. They are a potential that we need to do surveillance on also. Here in Tennessee, our small mammals are especially our species of greatest conservation needs. I mentioned that with like our eastern our Appalachian cottontails and things like that. Um, White-tailed deer birds. The highest risk actually is going to be potentially during fawning season when the umbilicus, is still fresh and it hasn't healed over yet. And what they've actually seen in other places is rut actually is when you see most of the problems occurring if the flies are still around. Um, and that's strictly because during rut they're fighting, they're getting injuries, they're creating wounds. And so typically during rut is another high risk time. And there's also a lot of potential for population impacts. We just don't know at this point in time. We have the densities of animals on the landscape are different nowadays than they were when the fly used to exist in a lot of the areas here in the southeastern United States. So we're not really sure if it gets introduced into our wildlife species, what's actually going to happen because the way we manage them is different, the access that we have to them is different, and just the densities out there in the landscape is different. So some of the things that we've done to prepare, we had a workshop last year where we basically gave all the same information to our field staff so they could be on the lookout in case something came in. We gave them options for how to collect the samples and produced a document for our staff. And then we reminded them again this summer of all that once it was confirmed in the United States. And so we have a bunch of different things that we get our hands on animals on a regular basis. So we're working with bears constantly because of the issues that we have in East Tennessee with human conflict. Um, Hunter check stations this fall. We'll be looking again. Last year we were looking just to make sure there wasn't anything. Feral hog trapping, again, potential surveillance there. Predator management work, like so people that are removing animals for predator control, things like that. Just looking and making sure they don't see wounds. Any of the bird banding projects, things like that. In our different wildlife management areas, if they're coming across dead animals, we're asking them to take a look at those things. Some of our external partners also working with wildlife rehabilitators and zoos, nuisance wildlife operators or animal damage control operators. Anybody that has a big game depredation permit, kind of making them aware. And so, in our scientific collection permittees would be potential folks because they're out there in theory handling animals. These images actually here are from South America. And you'll notice the taper, and we don't have mountain lions here. I'm just going to say that as a disclaimer, but it's a gives an example of what you can see on a trail camera, like these different lesions, and if you can follow up and go and get those animals in that area, you can actually determine whether or not those are. And these were on a handful of these. they were able to follow up at least with the tapers, and they were able to treat those animals and get rid of the infection that they had. So in terms of the other external partners, hunters, landowners, any wildlife observers, anybody with a trail cam out there, if they see anything suspicious, we'd like them to actually let us know. And I'm keeping track of time here to make sure we got time. But these are kind of our next steps. Some of this is still in the works as we're getting closer to hunting season, but we're looking to adapt an informational document for hunters and landowners. We are wanting to provide guidance before deer season. We do have an opening season or a mini season this weekend, but we're looking to get information out before archery, which is at the end of September. We want to engage our fur trappers and continue our internal preparedness and training as needed, as well as develop carcass disposal guidance if somebody happens to find something. Here are some of the resources that are currently available. Screwworm.gov kind of is a jumping off point and will actually get you to all these others if you do some deep diving. Katie Smith and Becky Trout Frixell here in UT put out extension pub W188, which you can get off the extension website, the publication website. That kind of gives you the history and more detail than I was able to give today on New World Screwworm. But USDA, FDA, and CDC, obviously, humans can potentially be impacted as we've seen. So just something to consider. In terms of if you have suspects, if you're out there handling animals, uh, first stop would be the state vet's office or cord lab. The easiest way is to preserve these things is in 70% ethanol. If you're in a pinch, isopropyl alcohol will work, but they tell us it's not preferred. But if you have 70% ethanol, it's the best way to preserve the larvae or flies if you happen to collect them. At UTCVM, Dr. Gerhold's lab is able to do the initial screening on these. Ultimately, everything that's a suspect, whether it goes to cord or the vet school, goes to NBSL for final confirmation. They're doing a combination of visual but also genetic testing on these to confirm that it is actually screwworm and the screwworm of concern, since there are other similar species visually that will look the same. On the wildlife side of things, if you have something, you can either get in touch with Sonia Mongold, her email's there, or myself. And if hopefully there's not human cases of it, usually that would involve travel at this point. But obviously, you'll want to contact the Tennessee Department of Health because that is reportable to them also. And I guess hopefully I left enough time for questions. I might have blown through things a little too fast, but we'll open it up. I always throw this out there because I never know if students are available or if there's anybody on this call that wants to kind of come and see what we do at check stations. Our opening weekend of muzzleloader and rifle are when we do have our check stations, and we're always running those across the state. Those are usually done on Saturdays on the opening weekends. And so those are opportunities if people want to volunteer with us and come out and see what we do, or even to get your hands on some of these animals and take a peek at them. Um, with that, I'll open it up to questions.
Thank you so much. That was it
It's a
was
lot.
a lot. Yeah. Is anyone
Oh,
hungry? But that was a great talk. Um,
and there's a
I
lot more information out there. Again, just try to highlight some of the important things that have been going on and what we know right now.
I threw that publication in the chat, a link to it. And also folks should be able to unmute themselves now if you want to ask Dan a question, or you can put it in the chat as well. And I'm sorry, Deb, I cut you off.
No, that's fine. Yeah, I was just going to say, I know there are some students that I asked to be on this call, and they can watch it later too. But those of you who are on this call, please reach out to Dan because this is an awesome opportunity for you. So yeah, time for questions.
Quiet group. Everybody's eating their lunch. We're trying to.
Yeah, I'll start. So, and this is kind of just a basic question, but F10 is allowed to be used for everything except dogs and cats?
per label.
Okay.
Per label. I think there's and reading up on it, I think there was some toxicity in at were reported at one point in time. And so I just think that's why they're not willing to say that it's all because it's technically it's all off-label use if you get into all that
Right.
FDA side of things. So
Yeah.
yeah. So
Okay.
it basically it's the if you use something that's not conditionally approved for that species and something adverse occurs, then you are liable for it as a veterinarian.
Yeah. Yeah.
So yeah, if they it's like anything, right?
Yeah.
You got to use your best judgment, but yeah.
Okay. Interesting.
Yeah, most of our topicals though, it sounds like I listed a few there, but the topicals, that's what they actually recommend. Clean the wound out as best as you can if it is a domestic animal or a cat or a dog. And then that topical actually will help kill anything that's still ingesting if you miss anything.
We have a question in the chat that says, I grew up in rural West Texas long ago when screwworm was a huge concern. Do you think this round of infections will be controlled so it doesn't become that bad?
So far at this point, with all this, I mean, there's a lot more technology available to us for surveillance. It doesn't seem to have gotten a foothold yet. Now, given the livestock numbers that exist in that area today, that's why there's such a huge concern. And so I wouldn't say no, but I would say at this point, it seems like they've gotten ahead of it. And there's been a lot of effort. And a lot of money being dumped into this. Even the starting up of the new facility and the fast tracking of the funding for that new facility, it didn't have to go through all the regular government processes and everything. So they're really this is something they're really concerned about because of the cattle industry as well as our other small ruminants and things like that. But the cattle industry is the driver for all the efforts behind this, and everything else benefits from that. So I would hope that it doesn't get a foothold, but if it does, it could get ugly real fast. If that, I think that answers.
You mentioned that you know, there is continued monitoring in wildlife. So what kind of like intensive monitoring? Because I think about all those ranches that are in Texas and
Yeah. Yeah.
yeah.
And unfortunately, they've got maps that would be easier to show what they're doing in areas where they're looking, but they don't publish those.
Oh,
I've seen them as access to, like the things that we've, like when we talk at meetings and stuff, they'll throw them up, but I couldn't find them. But the short version of that is they're doing a lot of trapping and releasing. So they're
okay.
looking at and as well as anecdotally, and Sonia might be able to, if she's on, tell this story a little better. They actually have found like some deer that had lesions and they weren't lesions that had flies in them, but they kind of used them as sentinels. And then they went back and they were able to follow up to see that they didn't actually get it. And so, so there's a combination of that and some of the camera trap surveys that they're doing. There's a lot of them out there. The live capture as well as they're using the drones. So different groups are using drones for like livestock, and then the wildlife folks are looking at the wildlife side of things if they can. And of course, Texas in that area has a lot of animals behind the fence that are wild,
Mhm.
wild species, exotic species. And so they're monitoring on both sides of the fence in those cases. Again, looking for animals that are sick or have obvious lesions, like animals that aren't doing well. Those are the kind of animals that they're focusing on. And to date, they've not actually, again, I've looked it up as recently as this morning to figure it out, but there haven't been wildlife cases reported in the U.S. yet. Now, there are wildlife cases obviously throughout Mexico and Central America at this point, but they haven't found anything in wildlife yet here.
Oh, that's interesting.
Yeah, and whether that's a time of year thing
Mhm.
or a density issue, like there's not a lot of wildlife close to where these cases have actually occurred. Um, it's actually hard to kind of like ferret that information out at this point, from my understanding. But they are trying to do their best, and with the fly trap surveys, is kind of giving them an idea of where the flies have expanded to. Again, there's not been many, if any, female flies caught in the fly traps that they've actually set out. So
Okay. And then with the cartel, since they were responsible for moving it like around in Mexico, there's really,
they're not. I mean, okay. Disclaimer: they are one of the sources of movement in Mexico that's
right,
harder to control. So I'm not.
right.
I
Yeah.
don't need anybody coming after me, but.
But there's
But
not
there,
really,
yeah, I mean, it's a little bit hard, it's a little bit different world in terms of movement regulations and being able to actually control movement
okay,
of animals. Because if you follow it, there's like 300-mile jumps, so that's obviously animal movement, you know,
right,
and
right,
not the fly moving.
right,
I think worst case scenario, and this will touch on some of the other questions from earlier. Just hope for that we don't get a hurricane through the Gulf,
right,
because that may push the flies that are in Mexico further north, right?
right.
So those like adverse weather events and things like that could actually serve to drive, or even physically move flies, right? So those are some of the things that we just don't know, and how far that might actually occur. So. And there are some interesting patterns of just even movement in Mexico along what the natural movement would be from herd to herd. There is a dividing line it's kind of hard to tell on the maps that are available, but there is sort of a dividing line as you head up towards the Baja Peninsula and things. There's just a terrain where it's probably not suitable for flies to um, exist. But so it's going from population of cattle to cattle in those areas. If
Okay.
that So yeah, it's not necessarily going to be environmentally stable in some areas, but it will exist if it continues to have hosts to spread in.
In the chat, someone has asked if the slides are available to review the resources. And I will just say that this recording will be uploaded to this seminars page of our website. I'll put the link um, later this afternoon, which is also where you can find upcoming seminar info. Dan, I don't, if you want to and you're able to send the slides, I can throw those on our website as well.
Yeah, I
Um,
can do that. I basically took everything from other folks anyways,
okay.
as in my disclaimer. But easiest thing, if folks really like, a jumping off point is screwworm.gov. And most of the resources, you just have to basically, you can do that, you end up down a rabbit hole if you keep clicking links. But that is, it's designed to be the jumping off point for all different aspects. And if you go down through the USDA website, that which is who hosts that, there are a bunch more links for different user groups. So they have one for veterinarians, for wildlife officials, for state officials, for producers, for so like they have a bunch of different user group information through that website. But yeah, I can provide my slides.
And then another question in the chat, who can folks contact if they're interested in volunteering? Is that you,
Yeah, you
Dan?
can get in touch with me and I can direct them to the appropriate. Or if they're there on campus, Deb, correct me if I'm wrong, is that WDA that does that, or is that Wildlife Society that does those?
I think both, but because it
Okay.
can, yeah, both of
Yeah, if
them.
you're a member of either one of those clubs, they'll be that you can work through them, or you can just get in touch with me and we can point you in the right direction.
Mhm.
We are nearing the end of our hour here. If anyone has maybe one more question. I don't see anything coming up in the chat. Okay, well, then I will just remind everyone to join us next month on September 24th. And again, if you want to rewatch this seminar, it'll be available on our website a little bit later this afternoon. And with that, Dan, I'll just thank you so much for joining us today for that very interesting talk, a slightly upsetting talk, but no, very timely, good
Hey,
information.
disease isn't always pretty.
Yeah, for sure.
It's
And
fascinating, though.
and thank you everyone for joining us. We appreciate it.
Thanks. Thanks, Dan.
Thanks, everybody.